So I'm Leighton Ku. I'm a professor of health policy and management here in the Milken Institute School of Public Health. I do research. I also teach research methods and health policy. I grew up in San Antonio, Texas, so pretty far from here, but have been living in Washington now for a long time, so I think of Washington as my hometown now. I started in public health through a roundabout route. I went to graduate school at Berkeley many years ago. I worked for the federal government. After that, I then got my PhD. Then I worked for a research institute, an advocacy organization, and eventually I came to GW. So I've sort of wandered around various areas in public health for a number of years. Health policy today is just this remarkably changing area, and it's moving so quickly. Part of the most visible part was the Affordable Care Act, passed in 2010. There are still a host of issues that are arising from that, as well as the ongoing public debate about should we have had this law in the first place, should it be repealed. One of the things that's just happening right now is public health and healthcare are beginning to intersect somewhat more. But again, part of the other aspect is if you're dealing with things from a policy perspective, that you're trying to sort of craft both policies and programs that keep up with the times and then figure out how can we do a better job? How can we make things better for people? So the main courses I teach are statistics courses. So what I hope that students will get is one of two things. Some of them are going to go on and need to do research analyses in the future. And for them, I hope they learn the craft of what's involved, how to do a good analysis. Some of my students I know will not be doing those sorts of quantitative analysis, but on the other hand, they need to understand what went into that research. How do you know that when someone says this has been shown, that it actually has been shown in a good way? A truly great public health student brings together certain qualities of intelligence, but also initiative and passion. And these are the things that I think come together, that I see in the students who really have both capabilities, but have a sense of where they're going and how they want to try to change the world. My favorite thing to do in DC, there's a consensus. I like to work. I'm a nerd and a wonk, so I actually like coming here to school and to work, and I like doing that. So I'm sad to say I even work at home. My wife complains about it, but other than that, I do the same sorts of things. I like to go out. I like to go to restaurants. I like to go on trips and vacations. So there are all sorts of fun things to do. DC is a great place to live. Three things I can't live without include, because I'm a nerd, I like my computer and my ability to access things, including both the computer and the internet. I like my wife. I like my cats. Potentially embarrassing to say is that I read comic books. Here I am, a full-grown adult. I have this massive collection of comic books collected over a lifetime. My area of research is basically trying to understand what are things that we can do in policies to help improve people's access to care, and then how they can use that care to improve their health. One thing that I'm trying to work on right now is how can we get Medicaid to do a better job in terms of helping people stop smoking. That's a case of where we could ally some important public health goals, reduction of smoking, with the health insurance system. Part of what makes GW such an attractive place to come to school is, on one hand, the location makes a big difference, but it's also that the faculty and the student body are great and very engaging and really do try to help people advance in their career. So they're trying to work hard to teach in their teaching aspects, but we're also doing good work from a research and policy perspective. So I'm Leighton Ku. Thanks for watching. I hope to see you come to GW at some point in the future. Bye.
So how many do you have in your collection?
Oh, you really, it's embarrassing to say. Maybe 15,000, 20,000. Like it sort of fills a room.